My job as a dentist is to help people make the right decisions about their oral health care, but at the same time, steer them away from stuff that is just gonna be a complete waste of their money. Which brings me to 4 things that I would never recommend you get done at the dentist because it is going to be a waste of your money and not actually do much for you. And number 1 on the list is changing out your silver fillings for fillings that are tooth colored just because you want them changed because of the color, or your dentist convinces you somehow that you need to replace them because these fillings have mercury in them. Now this one just drives me crazy because honestly this is a scare tactic to get you to do more dental work in a lot of cases, and there is some benefit for replacing these, but in general replacing a silver filling for a tooth colored filling will do absolutely nothing for you except drain your insurance coverage and cost you a little bit of money. And there have been lots of agencies that have actually covered this, right? The US FDA, which is the Food and Drug Administration in the United States, the WHO, which is the World Health Organization, and the ADA have actually investigated this very thing. Is there any benefit to changing out silver fillings for a tooth colored one? And they have unanimously voted no, it doesn't actually do anything for you. And sometimes it's better to just leave them as is because there is more of a risk of harm to your body and to the doctor removing these silver fillings than actually leaving them. The ADA, or the American Dental Association, has come out and said that they agree with the FDA, and I quote, "The ADA supports the FDA's recommendation that existing amalgam fillings in good condition shouldn't be replaced or removed unless it is considered medically necessary." And honestly, your dentist telling you that it is medically necessary to replace a silver filling because it has mercury in it is not actually true. You see, mercury is used to place a filling, but once a filling is in place, you removing that silver filling is more dangerous for you than actually leaving it. And according to the FDA, the Federal Drug Administration in the United States, they said, quote, "There is little to no information about the effects of leaving silver fillings in people's mouths. So essentially it is healthy to leave those in there, and removing them a lot of times is a lot more dangerous than just leaving them." Take these 3 teeth for example, only one of them needs a replacement filling, right? This silver filling is perfectly fine. There's no staining, decay, it's not broken, there's no risk of leaving it. This tooth is totally fine, it just has some staining, maybe it needs a sealant, but does not need a filling. Now this dark and stained, falling apart, cavitated, stain around the edges filling absolutely is the one that needs to be replaced. Now, if you want to replace fillings just because you don't like them cosmetically, that is totally okay, but functionally don't replace them because you're worried about mercury leakage. So when do you replace silver fillings? When they are cracked, broken, decayed, stained, or missing. But if you want to replace them just for the sake of replacing them because you're taking an old material out and you're putting a new material, that is a very expensive procedure that literally is not necessary whatsoever. Now, I will tell you that there is a thing called a placebo effect. You actually feel better about doing something because in your mind you're fully convinced that it is going to change your life or make you feel better. Now, when people say they get their silver fillings replaced with white ones and they feel a whole lot better, that could actually be the placebo effect. And if that is the reason that you feel better because you have your fillings switched out, that is totally fine. But it is very well documented that it is better to leave them in and does absolutely nothing for your body health-wise if you replace them and take them out of your mouth. Okay, number 2 is doing braces on teeth that don't need braces, right? If your teeth look like this and they're really, really crooked, yes, you do need braces because there are lots of benefits of straightening your teeth. But I see a lot of patients that do braces just because all their other friends are doing them and they don't actually need those braces. So just doing something because everybody else is doing it is not necessarily the best thing. And honestly, it's probably just going to be a big waste of money, especially if you're a parent and you have 3 or 4 or 5 kids. Saying that they all are going to need braces 100% just because that's what you do and that's what you did growing up and that's what all your friends do is not actually necessary. What I think a lot of patients don't understand is that braces is an optional treatment. You don't actually have to have it. It is in no way a necessary treatment. It is not a life or death thing if you do braces or if you don't do braces. People that have crooked teeth that don't do braces are totally fine. Yes, there are problems with that, but in the end they are fine. They're gonna be okay. Number 3 is that you're getting a deep cleaning and you don't actually need a deep cleaning. And this one drives me crazy. I've made a lot of videos about this, how this is sort of a scam in the dental industry, that people are getting deep cleanings because dentists are making more money. And it drives me crazy that I'm seeing this pushed all over the place in the industry. I'll give you an example. I had a friend go to a dentist and he said, you need a deep cleaning because on the backs of his second molars, those are the molars that most people have in the way, way, way back, have deep pockets and you need a cleaning because of that. And it is true, he does have pocketing, which is a sign of needing a deep cleaning on the backs of his molars. But he does have that because he had his wisdom teeth removed. When you get your wisdom teeth removed, you absolutely are gonna get a deep pocket back there because there's nothing back there to support the bone and the gum. And so you have a little bit of recession, you have a little bit of bone loss in there. And to be honest, a lot of times when we remove wisdom teeth, we actually have to remove a little bone to get the wisdom teeth out. So long story short, my friend has spent about $2,000 on a deep cleaning and it was not a necessary procedure. So he spent all that money on something that he actually didn't need. And to be honest with you, it's actually worse to get a deep cleaning on somebody that doesn't need one. It would be much better for their teeth if they just got a regular cleaning every 6 months. Which leads me to the next thing about gum disease. Who needs a deep cleaning because they have gum disease? A lot of people don't really know because it's silent, it doesn't hurt. So if you're questioning whether you have gum disease, I made a list of all the symptoms and signs to look for so then you can talk to your doctor and make an informed decision and probably get a deep cleaning because you really need one. Number one are red swollen gums. Gums should be coral pink and they shouldn't be puffy and they shouldn't be red. They also shouldn't bleed when you floss. Gums that are receding away from your bone. If you notice your gum line is receding or you have recession on 1 or 2 teeth, maybe on 3 or 4 teeth, that could be a sign that there's an underlying bone inflammation problem and you might need a cleaning there as well. Loose teeth, separated teeth, pus, or this like metallic taste that you get in your mouth in between your teeth is another sign that you might have a problem with your gums. Sores that keep on recurring in your mouth or a really foul taste or bad smelling breath could be another sign. And number 4 would be dentures without implants. Okay, dentures are a dentist's worst nightmare because we do a really good job and the patient ends up hating it because you're taking plastic teeth and you're representing what the patient used to have, which are natural teeth. So in case you don't know what a denture is, it's like if somebody loses all of their teeth, especially their lower teeth, and you put a plastic plate on there so that they can smile, they can chew, that is what a denture is. But a denture alone is awful for the patients. In fact, a lot of dentists are saying, I won't even do these because they are so bad. Not that the dentist's work is bad, but it's just really, really difficult to take a plastic plate and make it function like real teeth. Fortunately, now we have dental implants that can actually be put to stop this problem of the denture rocking every time you eat, every time you use your tongue and it thrusts up. The denture isn't launched out into space out of your mouth and does not boggle around anymore. Dental implants that are placed here and here are going to help your denture be much more stable. In fact, I've heard estimates of this actually making your denture, instead of having, let's say, a baseline of 0 biting power, it is anywhere from 4 to 8 times the biting power that you had before you had dental implants. So dental implants. And that's all I have for this video. Thank you for watching. Hit this button down here or comment down here if I left anything out. If you have done a dental procedure and you absolutely didn't like it and you wouldn't recommend anybody else do it, leave it in the comments below. And like always, thanks for watching and I'll see you on the next video.